Hello, and welcome to my exertional heat illness diagnosis and treatment presentation. So first, we're going to go through the video on the dummy that we have in the classroom. I'm going to talk through it while it's playing. So we want to remove the patient from the playing field. We obviously are using the Gatorade towel as a drape. I'll pause it there. But we want to drape it for privacy. Optimally, the patient would be sidelying and not prone, but in this scenario, due to the dummy being difficult to maneuver, we'll keep them prone. We want to clean the thermostat probe. We want to lubricate it if necessary. We want to turn the thermostat on, insert the probe. If any resistance is met during insertion, you should stop, remove, and try again. And as you can see, I'm using tape to keep the probe in place during the treatment. Once tape's in place, we will put the pants back on for privacy reasons and make sure that the thermostat is on and working sufficiently. Moving on, we will go to the recognition of heat stroke. So the symptoms are excessive fatigue, syncope, minor cognitive changes, pale skin, dehydration, staggering, lightheadedness, and diarrhea. The main thing that we are looking for, though, with the rectal thermometry being used is to see if that core temp is less than or equal to 104 degrees Fahrenheit. If you see that it is equal to or less than 104, combined with the symptoms listed, you will most likely have a case of heat stroke. The treatment for heat stroke is to move the patient to a cool shaded area, rehydrate them orally if the patient is responsive, remove excess clothing, cool the patient with ice towels, fans, or any means, reassess patient every 5 minutes to ensure that treatment is working, and to monitor vital signs. And now switching over to exertional heat stroke. Recognition. The symptoms that you'll see with exertional heat stroke are personality changes, combativeness, confusion, dizziness, staggering, syncope, dehydration, diarrhea, fatigue, headache, and vomiting. Once again, with the rectal thermometry, though, we will look at the core temperature being one of the pillars. If you see that the core temperature is greater than or equal to 105 degrees, you will know that you're dealing with a case of exertional heat stroke. Especially if you see that the core temp is that high, paired with CNS dysfunction, you know that you have a case of exertional heat stroke and you should treat it accordingly. The treatment of exertional heat stroke ideally is to immerse the patient immediately in a cold water tub. You should continuously stir water and add ice if possible to ensure that the water stays below 55 degrees and kind of in that 35 to 55 degree temperature range. Do not transport the patient until their core temperature is below 102 degrees Fahrenheit. We believe that we cool first, transport second. And then while they are in the tub, you should be constantly reassessing core temp if the rectal thermometer is able to stay in. If the rectal thermometer is not able to stay in during cooling, you should reassess it at minimum 5 minutes. If you have no access to cold water immersion, or if a patient is showing signs of additional problems, you should know that the patient should be transported immediately and that cooling can happen during the transport. Thank you.